Hi, I'm Dr. Deva Boone of the Southwest Parathyroid Center. I want to talk to you today about calcium supplements and specifically the most common mistake that I see people making with calcium supplements. Pretty much everybody who has parathyroid surgery will need to take calcium after their parathyroid operation. And for patients who have bone loss like osteoporosis, I recommend staying on calcium longer term. But I usually have to go into the calcium supplementation regimen in detail because of this very common error that I see a lot of people making. So let's get into it. When you go to buy your calcium supplements, there is usually a huge selection, either at the store or online, where you can find about 1 million different types of calciums, different forms, hard pills, chewables, etc., and different amounts in every pill. And that is the biggest mistake. The biggest mistake is figuring out exactly how many pills you need to take. Okay? Seems like an easy thing, but let's go over, I want to show you a few of the common bottles that I see come through, and let's try to figure out exactly what you would need to take and how much calcium you'd be getting. So here is one example. I really like this calcium citrate. It's a good supplement, and it's calcium citrate that tends to be well tolerated, a little bit better than calcium carbonate, so that's good. Now, how much calcium are you getting here? So for a lot of my patients, they might need to take 1,000 milligrams a day long term. Okay, so if you look at this bottle, it has 1,000 milligrams, which is very convenient. It's easy then. How many pills do I need to take to get 1,000? Well, most people would assume I need just one. That would be the most logical thing. If the bottle says 1,000 milligrams, logically, it's 1,000 milligrams in each pill. However, with calcium supplements, this is usually not the case. You'll notice it says in very tiny letters per serving on the bottle. So, but how do we know what a serving is? Let's look on the back of the bottle. Here's the back. Okay, so again, we can see supplement facts. It's got calcium in it. Look at that serving size. That is 4 capsules. So in order to get 1,000 milligrams of calcium, you have to take 4 capsules, not just 1, 4. All right, so each pill has 250 milligrams of calcium. Now, maybe you're thinking, okay, this is somehow standardized. Maybe the amount of calcium per pill is the same. All right, let's look at another example. So this calcium, another good brand, it has 600 milligrams. It doesn't say per serving. Maybe that is per pill. Who knows? It doesn't say what type of calcium it is. So we don't really know, but it is calcium. And it does have vitamin D3, which is good. You do want to take vitamin D if you're taking calcium. Here's the back of the bottle. So it is, in fact, 1 tablet per serving. So there's 600 milligrams of calcium in each tablet. And we can see there's 400 units of vitamin D3. Okay, so the first pills we looked at had 250 milligrams per pill. Now this is 600 milligrams per pill. If you're not paying attention, it's very easy to get the dosing wrong. All right, another example. Okay, calcium citrate, again, the calcium I like, and it says 600 milligrams per serving. Well, what is a serving? Is it standardized at all? Absolutely not. For this one, it's 2 tablets. So each pill has 300 milligrams of calcium in it. Okay, just a couple more because I know you're getting it. But calcium, this is 1,500 milligrams plus vitamin D. Notice that per serving is written there. It's always in tiny letters. They never really advertise the fact that it's per serving, and they almost never put what the serving size is on the front of the bottle. Almost never. You have to look on the back of the bottle to see what the serving size is. Okay, so it's true advertising because they are saying per serving, but they're not saying what the serving size is. Here on this one, it's 4 caplets. So 4 caplets gives you 1,500 milligrams. There's no standard for what is in each pill, for what the serving size is. There's no standard at all. They can do whatever they want as long as they have it on the back of the bottle. Here's some examples of calcium, some that I really like, that don't even tell you a dose on the front of the bottle. You have to look on the back to figure it out. I don't know if this is better or worse, but regardless, you have to look on the back of the bottle for every supplement. Okay, now I'm going to get into one that is super confusing for pretty much everyone, including physicians. This is a very common antacid. I've blurred out the name, but you all know exactly what it is. This is the extra strength pills with 750. Okay, it doesn't really say what it is. It doesn't say that it's calcium, but this is a calcium supplement. You can take Tums as a supplement. You just need to understand the dosing. And for Tums or any version of Tums, any generic version where it's listed as an antacid, you really have to look at the bottle carefully. Okay, and here is why. So here's the back of the bottle. There's a lot of information. Let's focus in on that top part, all right, where it says active ingredient per tablet. Okay, so it's per tablet. We know we don't need to do some complicated math to get it. It is 750 milligrams per tablet. Okay, that's good. Is that the same as what we were looking at before? No. Because on the prior bottles, they were selling a calcium as a calcium supplement. This brand is selling it as an antacid, not a calcium supplement. So the active ingredient is not actually calcium, it's calcium carbonate, which is just a form of calcium. All calcium has to be bound to something because it's not a stable metal, but it's calcium carbonate. That's the active ingredient. There are 750 milligrams of calcium carbonate in each pill. That is not 750 milligrams of calcium. All right. Calcium carbonate, actually 40% of that is calcium. The other 60% is the carbonate part. So now we have to do some math, and we don't have to do too much math. It really is on the bottom of the bottle in tiny letters. It does say each tablet contains elemental calcium 300 milligrams. All right, that is 40% of 750. So if you're going to take an antacid like Tums or any other generic calcium carbonate as your calcium supplement, that's actually fine, but you have to be very careful about the dosage. Each 750 milligram pill of Tums has 300 milligrams of calcium. Similarly, every 1,000 milligram pill of Tums, which is another form you can buy it in, you can buy the 1,000 milligram pills, each one has 400 milligrams of calcium. So I often have patients tell me that they're taking 4,000 milligrams of calcium a day because they're getting 4 of those 1,000 milligram Tums. What are they actually taking? Well, they're actually only getting 400 milligrams times 4. So they're getting 1,600 milligrams, not 4,000 like they thought they were taking. So it comes down to you have to check the label. You have to read the label carefully. You have to look at what the active ingredient is. If it's a calcium supplement, it is going to list calcium as the active ingredient. And you may see it as calcium in parentheses as calcium carbonate or as part of calcium carbonate and calcium citrate, something like that. But calcium itself will be the active ingredient. When it's an antacid, calcium carbonate is the active ingredient, and only 40% of that is actually going to be calcium. So it should say on the bottle where it is. You usually don't have to do any math. They will list it on the bottle, but you have to be very careful about looking for it. All right, I hope that helps. Take care.